I'm Dale Smith for Looney Politics, and certain parties are trying to sow some confusion between what the federal government has done around vaccines and the roles of Health Canada and NACI, which is the National Advisory Committee on Immunization. Now, some of these narratives are that the federal government decided on or approved of the dosing delay of up to 4 months between first and second doses, or also that they are providing or signing off on the advice around which are the preferred vaccines. None of this is really true because the federal government's role is very limited. They procured the vaccines on the advice of an advisory committee, and distribute them to the provinces, but that is as far as their influence really goes. Now, Health Canada, as the regulator, ensures that these vaccines are safe for use and, looks at them as though it's the vaccine or nothing, rather than which vaccines it would weigh against, whereas that is the role of NACI. NACI has to look at the available evidence of the vaccines available, look at the epidemiology around the country in terms of which areas are in more need or other, and then they get to make some recommendations which the provinces can then either accept or reject based on their own public health advice. This notion that NACI is somehow guiding what the federal government is doing is also not exactly correct, because NACI operates at arm's length. The federal government doesn't control them, and they don't actually exert influence on the federal government either. Again, the responsibility for vaccine delivery falls on the provinces, so they can listen to what NACI has to say or they can reject it. It's up to them. Part of why we're having some of this confusion somewhat deliberately is in order to try and pin stuff on the federal government which is not necessarily their problem. The 4-month dosing interval, for example, was about the public health advice to get as many people having first doses as possible given the constrained vaccine supply, whereas the initial advice from the vaccine manufacturers was for 3 to 4 week intervals between doses. But we're now seeing studies that are proving that there can be higher immune responses for delays up to 12 weeks. So in other words, decisions that provinces made together with their public health officials, as well as listening to NACI, may have proven more prescient than we would have thought. However, none of this is actually the federal government's call, and we need to ensure that when people are trying to say that it is, we can correct them. For Looney Politics, I'm Dale Smith.